I'm Imani.
And I'm Shelby.
This is our lab 4, and we're going to begin with palpations. So what I'm going to do is I'm going to palpate Shelby's metacarpals 1 through 5. And if you look at her hand, you can see how they kind of protrude out a little bit after her door knocking muscles. So her metacarpal of 1 will be here on her thumb. And then this is 2 on her index finger, 3 on her middle finger, 4 here on her ring finger, and then 5 here on her pinky.
And I'll be palpating the scaphoid. So if we're looking at the palmar side on the thumb side of the hand, let's see. Let me do this one. Yeah, there we go. Where you have your big pad right there. If you feel, you'll feel the scaphoid. And then the last one is decapitate, which we'll both show.
On ourselves?
Yeah, I guess we'll do it on ourselves.
So if you look about the line of your third metatarsal, you should...
Metacarpal.
Metacarpal. Oh,
it's okay.
Metatarsal first time?
No.
Okay. You'll find like a little divot here in between your wrists.
And when you flex, you'll go up one more bump, and then that's where your capitate is. Yay.
Okay, so now we'll be doing manual muscle tests. So I will be instructing Shelby on how to perform the manual muscle test for the pronator teres / quadratus. So what I'm gonna have Shelby do is hold her arm, her elbow flexed at 90 degrees with her fist balled up. And I'm gonna instruct her not to allow me to turn her hand over to supination. So that way she'll be working her pronators. On 3, I'll try and turn you, resist my motion. 1, 2, 3. I'm gonna do a little bit harder. 1, 2, 3. She's at a 5.
And I will be showing or doing a manual muscle test for the flexor carpi ulnaris. So for that one, I'll have my patient have their wrist out, and I will get them to flex their wrist and then ulnar deviate. There we go. And what I'm gonna do is try to extend their wrist and do a radial deviation at the same time. So don't let me do that. 1, 2, 3. And a little bit more. 1, 2, 3. Awesome. And since she was able to get in the position, she was at a 3, and then being able to resist both of those resistances, she is at a 5. Now I'll be doing the range of motion test for ulnar deviation. I'll have my fulcrum in line with that capitate that we had found earlier. Stationary arm in line with the lateral epicondyle, and the movement arm in line with the third metacarpal. We are starting at 0. I will then have my patient ulnar deviate, follow the third metacarpal, and we are at, where is it? 25 degrees, which is in range of motion, or in the standard for 25 to 40.
Okay, so now I will be measuring wrist flexion range of motion on Shelby. So I'll have my fulcrum at the triquetrum, which is the wrist bone right here on her ulnar side. I'll have my my stationary arm in line with her ulna, and my movement arm in line with her 5th metacarpal. I will then instruct Shelby to flex her wrist. And Shelby is at 96 degrees, which is a little above the typical range of motion of 70 to 90.
Now I will be instructing my patient how to stretch and strengthen their flexor digitorum. So first, to stretch it, I'll instruct my patient to pull their fingers back and hold for about, make sure you get your 5th, yeah. Hold for about 10 seconds, and we'll do that 5 times. Okay, great, we did that 5 times. And then for strengthening it without any equipment, just flexing our fingers in, yep. And we'll do 3 sets of 10, And then after that, we will grab equipment. I have a piece of paper, kind of like towel crunches, but instead you're trying to crumple up the paper. So I have my patient on there, and she is trying to crush it as much as she can. And this will be on a timer. We'll be crunching for about 1 minute, and if it gets all crumbled, we'll flatten it out again and do it all over again.
So now I will be instructing Shelby on how to strengthen and stretch her flexor indicus. So what I'll have Shelby do in order to stretch it is just take her index finger and bend it back, and we'll hold that for about 30 seconds for maybe 2 sets. To strengthen with no equipment, I'll have Shelby just flex it, going in the same motion as the muscles in the index finger, so she's flexing it. And then with equipment, I have this dried out wet wipe that I'll have Shelby just use her finger to grab onto, strengthening her muscles, and she'll do that up until the wipe is all completely crumpled up or until she can't anymore.